Thank you very much, Wendy. Thanks. Evening, everybody. Nice to speak to you. I have a mental picture now of you all hovering, as Wendy just told you to hover. I'm going to talk about patient safety. And to start with, I'd like Wendy, because I'd like to find out who you all are. So what is your role in practice? Are you a vet? Are you an RVN or SVN? Are you a practice manager, or are you another member of the practice team? Wendy, can we have the poll question, please?
Yep, I've launched that poll question, so that should be up on your screen. So it's just the first poll question that's showing that we need you to answer to start with. We have two showing on your screen due to the new software, but it is just the first one. What is your role in practice? Vet, RVN or SVN, a practice manager, or other? So we'll give people another few seconds to answer that for us at the moment. While they're doing that, your audio did go a little bit wobbly to beginning, Pam. We'll keep an eye on it, and if necessary, I may ask you to dial in on the telephone.
Okay.
Okay, so at the moment we have 100% of vets on this evening, so I'll end that poll for now.
Okay, that's interesting. I thought we may have some veterinary nurses too, but that's interesting. So, what we're going to talk about tonight is checklists and guidelines in practice, why they're important, how you draw them up in your practice, and how you go about actually implementing them in your practice. So those are the three sort of issues I'd like to talk about. So first of all, why do we bother with checklists and guidelines? I think we all make errors, don't we? Errors in practice. Certainly in my 30-year-plus career, I have made plenty of errors, which I don't mind admitting to. I've even made an error, that's a human in the picture, but I've even made an error like that with a splenectomy in the middle of the night with a dog hemorrhaging everywhere, and I left a small pair of hemostats in there. The splenic tumour recurred, and one of my colleagues found them when they opened the dog up again, and it was put to sleep because of the recurred tumour, but I told the owner and admitted what had happened, and it was a human error. So in practice there's lots of errors. Human errors, which can be making a mistake, forgetting something. It can be system failures, not having systems in place, and that's what we're going to talk about. And it also can be lack of communication between colleagues. So human errors, I think we're all prone to these, and they can be, because some of the problems we deal with are very complex. We have animals with lots of comorbidities and lots of things to think about. We can miss out steps along the way of things that we do every day, things that seem to be quite simple procedures. We can miss out just one step and the whole thing goes wrong. We can get distracted by other things happening in the practice, by somebody coming and telling you there's an emergency in the waiting room while you're in the middle of a surgery. We can not know some of the things. It's such a complex subject, it's impossible for us to know everything. We can certainly be tired and stressed, and then there's the pressure from the owners. So all those things can add up to human errors, and we have to be able to admit that we do make mistakes. And there's also system failures, where teams aren't working together, where there aren't enough members of the team, so everybody's under more pressure. Where there are no systems in place, or where if there are systems in place, they haven't been put in place properly and they're not working or people aren't using them. And of course, time pressures. We all have those terrible days in practice where there just aren't enough hours in the day, and there's so many things going on at once, juggling so many balls in the air, that it's not surprising that sometimes some of them fall to the ground and mistakes happen. There's also communication failures, and I think as practices get bigger and teams in practices get bigger and practices are open longer hours, so people are working different shifts. You know, in the old days in a small practice, you knew the team and you all knew how you worked, and you could work around each other. You could sometimes tell just by the way people wrote their notes exactly what they thought about something. But now teams are changing all the time. You might get temporary team members, locums. And then another really important thing is the culture in the practice. And that's why I've put the Mind Matters logo there. I think it's really important that the practice has an open culture where people can admit to their mistakes. If you admit to your mistakes, then you can start to learn from them. And we're looking for what's gone wrong in the system, not to blame somebody. And if the practice has that culture, then things can be brought out into the open, discussed, everybody feels better. When people keep things hidden away and worry about things, I'm sure this can impact on mental health and can be another of the issues. We have a problem enough in our profession with mental health issues, and I think not having an open practice culture and a no blame culture is certainly implicated in mental health issues. So those are the sort of things that can lead to the errors. Anybody who's not seen it, there was an excellent article in the Vet Record last year called "We Need to Talk About Error: Causes and Types of Error in Veterinary Practice" by Catherine Oxtoby. It's a great article. I would strongly recommend that you read it. And in that article, she used data which came from the VDS about the types of error that happen in veterinary practice. And there they are on the screen for you. And next to them are the equivalents for medical practice. So surgical treatment has got 41%. 41% of the errors happened in surgery. And in human medicine, 50% of the errors happened in surgery. In medical treatment, it was 15% of the errors for both. Then we have diagnosis. Then parturition things, so this will be the caesareans, but it'll also be the cattle caesareans and calvings that go wrong, because this is for the whole, across the whole species range. Then advice. The one that really surprised me was anaesthesia, 2%. And that's the same for human medicine, and I really thought that errors in anaesthesia would be much higher up there. But there were very, very interesting figures that she got from the VDS statistics, and I thank her for sharing those with me. So what can we do to reduce these errors? Well, we can make sure we've got systems in place and systems of work which make it less likely for errors to occur. So we can have protocols, guidelines and checklists, which we're going to talk about tonight. We can involve the whole team in drawing those up. We can do lots of training and teamwork. We can make sure communication in the practice is good as much as we can, really improve communication. We need that open, no blame culture. That's really, really important. Otherwise, these things get swept under the carpet, don't get discussed. And if they don't get discussed, nobody learns from them. And another thing that's really important is in that open, no blame culture, that people feel they can report incidents that happen, and also near misses. Lots of things can be learnt from near misses. When the wrong medicines are prescribed, which is very easy to do with drop-down boxes, a different size of the tablet than the one you were expecting gets dispensed, but somebody notices before it goes to the patient, goes to the owner, then that's a near miss, and that's a really good thing to learn from, because maybe you can tweak the system so that that's less likely to happen again. So those are things we can try and do to reduce errors. So do you think you've got systems in place in your practice now to reduce errors? The questions I'm going to ask tonight, they're questions really where I'd like to have your opinion. It gets some, when you're doing webinars, we sit here talking and we don't really know what the audience are thinking. As Wendy said, I'm used to doing SQP webinars where we have to ask the audience questions every 10 minutes. So that's why I've put some poll questions in.
Okay, I'm not sure if that poll question is appearing on everybody's screen or not.
Okay.
It was launched early and we have some results. So if people could just let us know if you did answer the poll question 2, which is, do you have systems in place in your practice to reduce errors? I believe if you didn't answer it before, it should still be on your screen. But if someone could pop that in the question box, that would be great. The responses I have, Pam, from earlier to that question, 73% of people said yes, and 27% have said no. So I'm sorry if I've made an error on those polls, Pam.
No, don't worry. That's absolutely fine. So lovely. Thank you, Wendy. So thank you. We'll carry on then. So we can't prevent human error. We've just talked about human error. We're not Superman, and I think there's a lot of research going on in the medical profession about doctors thinking they're invincible, and if you start to admit that you make errors, then you start to become more human. And we can't prevent human error, but what we can do, what we can try to do, is improve communication